Great. Well, welcome everyone to today's Center for Poverty and Inequality Research seminar. We are very excited to have with us Professor Drew Halfmann. Drew is a sociology professor here at UC Davis. His work specializes on social movements research and research on the politics of health and social policy. We'll be hearing about the politics of health today. You know him from his book, Doctors and Demonstrators, the award-winning book on how political institutions shaped abortion law in the United States, Britain, and Canada. In addition to being an affiliate of the Center for Poverty and Inequality Research, he's an affiliate of the Center for Healthcare Policy and Research here at UC Davis, and was a founding member of the Scholars Strategy Network Sacramento chapter. I know many of you got to see them in action yesterday during our jointly sponsored workshop. So I will turn it over to Drew to begin the presentation and encourage everyone here in attendance to use the chat, the Zoom chat function to submit questions just as they come to you, as you're listening to the talk, something that piques your interest or you'd like more clarity on, and we'll then use those questions following Drew's talk as the basis for our Q&A. All right, so with that, join me in welcoming Professor Drew Halfmann.
Great, thank you very much. Thanks for having me, and thanks to all of you for coming. So I want to talk about a paper today. It's got an R&R with Journal of Health Policy, Politics, and Law, which is mainly it's interdisciplinary, but mainly political science. And it's about the framing of health inequality, for the last 100 years or so, a little less, more like 90 years. And I'm having a little trouble with my mouse here. Okay, there we go. So I'll start with a few quotations that really sort of motivated the study. So this first one is from an article called Class, the Ignored Determinant of the Nation's Health. It suggests or claims a great deal of attention is being given to racial and ethnic disparities in healthcare. At the same time, the wide differences in health between the haves and have-nots are largely ignored. It goes on to say, because of the nation's history and heritage, Americans are acutely conscious of race. Hold on a minute, echo off. My Alexa is wanting to participate. Okay, because of the nation's history and heritage, Americans are acutely conscious of race. In contrast, class disparities draw little attention, perhaps because they are seen as an inevitable consequence of market forces or the fact that life is unfair. Now, the reason I put the citations for this, this quote is because the editors at J. Hipple feel like this just can't be true, these claims, and they feel like it's essentially nobody really believes this. And that may be true in political science and sociology, that nobody believes this, maybe, but it certainly isn't the case in these journals. And these are mainly public health people that I'm quoting here. This appeared in New England Journal of Medicine, widely cited. Another study cited in Health Affairs, health disparities by race and class, why both matter, argues that there's room in our public discourse to address racial health disparities while in general downplaying class disparities. Okay, so that's the claim. Oh, and some of them go further yet, and that is to say, it's not just sort of our discourse that is affected by this bias, but it's true in our policy as well. So we have Navarro claiming that European nations have committed to reducing inequalities by class, but the US has not. Instead, it's focused on race. We have others arguing that when Healthy People 2010 did pledge to eliminate disparities by both race and class, it ended up adopting a policy response that focused on race. So there's this argument too that it's not just about discourse, but also about the way that the types of policies we get. The people who are making those particular claims don't provide a ton of empirical evidence for it. There is better empirical evidence for an argument that race is overemphasized, well, not overemphasized, is emphasized more than class in government reports. So there's a study by Krieger and Fee that looks at federal health reports for most of the 20th century, finds that in the progressive era and the New Deal, SES got much more attention than it did after World War II, when race took the fore. There's a study sort of at the end of the 80s to the early 20s. They looked at 7 major federal reports. 3 of those focused wholly on race, 4 focused on race and SES. And in the figures included in those reports, race was mentioned 4 times as often as SES. Another study making similar arguments about reports from the National Center for Health Statistics. Another making similar arguments about Health United States from 2009. A paper by Krieger from Public Health arguing that race data was collected and reported more often than SES data for most of the 20th century in vital statistics reports, so this is birth certificates and death certificates, and that in '96, only 8 states regularly stratified their reports by SES. Many states were collecting education information by that point, but few were reporting it. So I find this claim, so I'm pretty convinced of the claim in terms of government reports. I'm less convinced of this claim in terms of health policy and policy discourse. So why should we care about this? A few reasons. So, and these are arguments that have been made in the literature. The first is about class-focused framing. There's a lot of research in political science and in sociology that finds that Americans are less likely to support policies that are targeted to low-income people and especially to racially oppressed people. A lot of this is reflective of efforts to stigmatize poor people and people of color, mainly Republican, but some Democratic as well, using discourses of work effort, fraud, criminality, immorality, fertility, and family dysfunction. You all are familiar with this. At the same time, Democrats have sort of adopted this idea that only universal policies are going to be popular, that targeted policies will not be. And so Democrats have often explicitly avoided either proposing racially targeted policies or talking about them. Obama's aides, mentioned, in fact, that, when Obama would do something that benefited African Americans, he would always be sure not to speak of African Americans when he did so. And this has been a pretty common Democratic strategy. Some problems with that is that you may be helping racial and ethnic groups when you make these policies, but you're reducing attention to racial inequality when you do so. It also really just sort of hinders explicit discussions of the advantages and disadvantages of those programs for marginalized groups and for racial and ethnic groups in particular. So that's sort of these are the downsides of class-focused framing. There are downsides of race-focused framing as well. So one is when the frame is race, it can obscure the fact that SES is a key causal pathway between systemic racism and health outcomes. It can suggest that inequalities between racialized groups are mainly the result of biological or behavioral differences. It can inhibit cross-racial working class mobilization by encouraging white resistance to health equity policies and blinding low-income white people to their own health disadvantage. So this is why this stuff matters, whether it's going to be framed in terms of race, framed in terms of class, preferably in terms of both. But these are, this is the significance of this issue. Okay, I'll end this little preface part by saying that the people who make these arguments about why class has been relatively under-examined in health inequality discourse, they make a few pretty macro level, broad explanations that they offer. So one is they say that Americans believe they live in a classless society. It's a very much sort of cultural argument. A second is anti-communism in the United States and our historically weak labor movement have discouraged attention to class. Another is that race is the dominant social cleavage in American society, and so that it makes sense that most social problems will be framed around it. These are probably true to some extent, but I find them to be sort of too macroscopic, too ahistoric. They can't explain variation across various actors or venues, so between presidents and experts, between political parties, and also between historical periods. And so they also run counter to a lot of research suggesting that policymakers have given less attention to race in the post-civil rights era. So on the one hand, they're claiming that race is being overemphasized, and yet you have other scholars arguing, well, race discourse is on the decline in recent decades. So that's where that leaves us. Okay, so just to review, we have two claims. Some scholars are arguing that all health policy discourse gives more attention to race than class. We have research showing that government reports on health inequality give more attention to race than class. My own hypotheses here, and this paper is mainly descriptive. I'm just trying to figure out where we're at in terms of presidential discourse. My hypotheses are that presidential messages are actually likely to give more attention to class than to race, and that attention is likely to vary across policy venues, thus between the presidency and the bureaucracy, between parties, and over time. And guess what? My hypotheses are right. Okay, so here's the data. These are health-focused presidential messages to Congress. They're of two forms. So one is State of the Union addresses. And I only examine those State of the Union addresses that have health-focused paragraphs, and it's those paragraphs that I examine. Health is often referred to in State of the Union addresses, but often in just very tangential fashion. But I'm looking for sections of the speech that discuss health explicitly. And then the second set of messages are messages that are sent from the president to the Congress in which health is the main topic. So there are 91 of these messages in total, 57 of the State of the Union addresses, 34 of the messages to Congress. So I'm not including, just a reminder, I'm not including messages to Congress that don't focus on health or State of the Union addresses that did not contain these sort of health-focused paragraphs within them. There are many different forms of presidential communication that I could have looked at: inaugurals, farewells, television addresses, interviews, campaign speeches, etc. I decided to focus on these two because I find them to be the most focused on policy, which is the area in which these claims have been made by other scholars. And I'm especially interested in the early stages of the policy process, agenda setting, when decisions are made about which problems should be addressed, and alternative specification, when decisions are made about what are the best solutions to those problems. So the analysis asks, how often are the health and healthcare of low-income or racially oppressed people mentioned in the speeches? I used dictionary-based computational coding. In other words, I made a dictionary of all the terms that might refer to those two groups. I developed the dictionary through a combination of looking at existing dictionaries, but then also, within my data set, finding analogous or similar words that would appear alongside those other words. Notably, only 11 of the messages that referred to racial and ethnic groups referred to specific groups. So 7 of those messages referred to African Americans, 4 of them referred to Native Americans. Otherwise, there were no specific references to any group. Instead, references were to broad categories such as race or racial, to poor urban areas, to underserved or underprivileged groups, to minorities, or to immigrants. One problem with this data is that sometimes it's likely that some of these references to low-income people were actually implying racially oppressed people, and vice versa. I can't really speak to those sort of implicit meanings in this analysis. This study has a qualitative component as well that I won't really get to speak of much today. But in that part of the study, I do try and address these more implicit meanings. Okay, so the findings, race versus class. First, presidents mentioned low-income people in twice as many of these messages as they did racially oppressed people, 61 messages for low-income people, 27 for racially oppressed people. Not a single president mentioned racially oppressed people in more messages than low-income people. Here's a graph of the findings. So the blue is low-income people. The red is racially oppressed people. And in almost every presidency, the references to low-income people, well, in all those presidencies, the references outweighed references to racially oppressed people. The black line that you see there is the number of messages. So you can see that the number of messages is quite high under the Clinton administration, under the Johnson administration, and under the Truman administration. 3 important reform presidencies. You also, well, I'll go in a later slide, I'll talk about sort of the partisan differences. But it's notable to me, at least, that Clinton makes the most references to low-income people, along with George W. Bush, which I found pretty interesting. Okay, on we go. Okay, in terms of the party and period effects, so presidents from both parties mention low-income people more often than racially oppressed people. In absolute numbers, the Democrats mentioned both groups more often than did Republicans. But in percentage terms, this was only true after the civil rights era, in other words, after Ford. And after the civil rights era, both parties referred to both groups less often. And I'll show you a table on this. So you see in the first period, it's from Roosevelt to Ford. Democrats gave 28 speeches, Republicans 15. Let's say messages, not speeches. Democrats 28 messages, Republicans 15. The percentage of the Democratic messages that referred to low-income people was 79%. The percentage of Republican ones was 80%, so very similar. Same with racially oppressed people, 46% for Democrats, 47% for Republicans. So Democrats did make many more speeches. So in absolute terms, yes, they did refer to these groups more often than Republicans did. And that's not, that is meaningful because, Democrats were choosing to put, health on the agenda, and Republicans were not. So, these percentages are useful, but also misleading in some way. So the absolute numbers are important as well. And then in the second period, the important thing here is that for both parties, the percentage of speeches, the percentage of messages that mentioned each of these groups really declined quite a bit, especially for racially oppressed groups. So you have, for Democrats, for low income, it's going down 79% to 61%. For racially oppressed group, 46% to 17%. Similar patterns with Republicans. Republicans actually fell more, though. So Republican on race is not as big a difference, but on low income, it's a difference. And so then looking again here, you can see in the sort of pre-Ford period that references to low-income people are pretty high among all the presidents, lower in the post-Ford period with the exception of Clinton and G.W. Bush. And then same story with racially oppressed groups. You can see that there are far fewer mentions in the post-Ford period, and that Reagan and Bush did not mention racially oppressed groups at all in these speeches. And Obama and Trump were tied. So there's a number of potential explanations for why these patterns exist. And they're really fairly standard in political science and sociology. And so, I find these findings to be more consistent with the political science scholarship than with the claims that are being made by people in public health. So one is that the Republicans, really sort of starting with Nixon, became sort of the racially conservative party. And so you start to see some changes along those lines. You saw, again, starting with Nixon, the extensive use of negative racial appeals by Republicans to get elected. Part of this was the racialization of poverty. You had the majority of America, in 1996, you had the majority of Americans believing that the majority of recipients of welfare were Black or Latino. At the same time, as the result of the success of these Republican appeals, Democrats started to take on these sort of race-neutral strategies as well. And then also you have a rise of colorblind ideology in both parties. And so these help to explain why both parties lessened their attention to lessen their mentions of both low-income people and people of color. So I'll just speak to the racialization part as well. So to the degree that poverty becomes racialized, if presidents have an incentive not to speak about people of color and Black people in particular, if they have that incentive and poverty has become racialized, they might also have the incentive not to talk about poverty or to talk about poor people in negative terms. Okay, so that's that part. Seems pretty standard. A little more interesting is this distinction, the differential findings between the government reports and the presidential messages. So one, a lot of research has shown that presidents have, well, certainly Republican presidents have ideological reasons to avoid talking about race. Democratic presidents have electoral reasons to avoid talking about race. So that helps explain, you would expect presidents to be a little bit more attuned to electoral forces potentially than experts and bureaucrats would be. I think it's fair to say that health policy experts and bureaucrats are more racially liberal than Republican administrations. Yet, even during Republican administrations, they can continue to issue reports that emphasize race because they have a lot of autonomy. They've been there a long time, they have experience, they have job security, and sometimes even if Republican administrations try to shut them up, they're able to appeal to allies in Congress to sort of overcome that. So this is all speculation. I don't, this study is purely descriptive. I'm trying to sort of, define the dependent variable, and then it would be a different task to try and understand why these differences exist. Okay, so a few more minutes left. So I'll end by talking a little bit about the qualitative part of the study. I won't go into great depth here, but you can look at this as more of an advertisement for that part of the study. In this part, I ask what are the tones and the frames of the mentions that the presidents make. The coding here is, I use existing theories of health inequality framing to help me think about, what tones and frames I might see, but I also use induction to try and discover such themes. This part of the analysis is far more interpretive, qualitative than the other part, which is, coming up with dictionaries that can sort of reliably code the mentions. So I identified three main tones in the speeches. So one was a committed tone in which the president would speak in emotional or moral or empathetic terms about health inequalities. Often the president would link these groups to various cherished values, traditions, particular policies such as Social Security, or to particularly valorized groups, veterans, for example. It would sometimes single out these groups for positive attention. So that's the committed tone. The detached tone is unemotional morally neutral, formalistic, sometimes even euphemistic. It sometimes disassociates presidents and their policies from stigmatized groups, or mentions only the most deserving, quote unquote, members of those groups. For example, poor children. Over and over again, you see references to poor children, but very rarely to poor adults. A negative tone actually stigmatizes, blames, or reinforces stereotypes about the group, proposes policies that might negatively impact the group, or biologizes race or racial inequality. I also identify 3 frames, and these frames can serve, they basically serve as sort of intensifiers or the opposite for the frames. So one is a special needs frame, and this is a frame in which a group is portrayed as having unique health or healthcare needs that are not adequately addressed by existing arrangements. But there's no suggestion here that there's no comparison to other groups. And it can include, and there's no sort of idea about inequality necessarily. It could be an argument, well, this group simply has special needs of whatever sort, perhaps biological, perhaps behavioral, and government policy should address them. A second frame is an inequalities frame, and this is when the group is explicitly portrayed as having worse health status or health care than a comparison group. So comparisons between Blacks and whites, for example, or whites and non-whites, quite common. Poor people and richer people, et cetera. And then lastly, there's a linkage frame where presidents mention lower class or racially oppressed people alongside other groups, such as the middle class, other racial and ethnic groups, children, the elderly, parents, or people with disabilities. This can kind of go either way in terms of tone. On the one hand, if you mention poor or racially oppressed people alongside well-regarded groups, it can sort of help destigmatize those groups. On the other hand, especially during the Carter administration, Carter would tend to make these very long lists of needy people, so long that you really had to wonder, if it really even counted as attention to these groups. So it's just a very sort of rote, formalistic way of linking these various groups together. I won't show you the findings. I'll just say that in those findings, I find that the presidents who showed the most committed tones towards low-income people were basically pre-civil rights Democrats, Roosevelt, Truman, Kennedy, and Johnson. Those who showed negative tones were Nixon and Clinton, but both of them combined those tones with more committed tones. Let me step back by saying by far neutral tones were the most prevalent for pretty much for all presidents. So this analysis is based more on, many presidents had only neutral tones. Some presidents combined them with committed tones. Nixon and Clinton actually used some negative tones, but they combined these with both committed and neutral tones. For racially oppressed people, Kennedy and Johnson used committed tones. Negative tones you could find with Nixon, Carter, and Clinton, again, combined with these other tones. This doesn't look very surprising. I think the only interesting anomaly here is Nixon, who was in sort of this weird position where the Republican, he was using racially inflammatory campaign strategies. But at the same time, the civil rights movement was just ending and the Republicans hadn't completely decided, which side they were on. In 1960, Nixon had argued that he was more racially liberal than Kennedy. And at that just not that long ago, the Republicans had been sort of touting themselves as the civil rights party in comparison to the Democrats. And then, the other thing people say about Nixon is that, his main interest was always getting reelected and popularity, et cetera, so that he would sort of zig and zag on a variety of policies. That fits right in there with him sort of using both negative and committed tones, and also being the only Republican to really show up in these findings. All right, so I'll end there, and I'd love to take your questions.
Thank you very much, Professor Halfmann. So yeah, folks can put questions in the chat. We can also probably just use the hand raising function if you'd prefer to just speak your question out loud. So there were a couple of questions. One I wrote, and then one that Michelle co-wrote, both having to do with the government health reports. So yes. I maybe just kind of missed where these come from and who are the people that write them, what kind of job titles. That was my question.
Okay.
And then Michelle, do you want to just say yours out loud?
Oh, it wasn't a question. It was just a comment to your question about who writes them.
Oh, okay.
Oh, maybe Michelle. Oh, so you were kind of answering it already, maybe.
Or just ideas.
Ideas about like variation across the agencies that are putting them out.
Right.
Got it. Exactly. Yes. So most of these studies are coming out of, Department of Health and Human Services, and there are, like department staff involved, but they also typically have an illustrious group of mainly academic experts that are heading up the study. And, they're not doing the writing themselves, but they're guiding the direction. So there's a lot of sort of this outside, they're sort of inside outside of government sort of actors. Thinking about the particular studies I mentioned, so that'd be true for healthy people. The NCHS studies, they have a wide variety of sources. The Black Report from 1985 is the study that really put racial and ethnic health disparities sort of on the agenda. And it originated from Reagan's Health and Human Service Secretary, Margaret Heckler, a liberal Republican. And she had actually been lobbied by the presidents of minority serving medical schools on this issue. And of her own initiative, she started this study basically, and drafted a bunch of people within government and outside to do it. In the end, the Reagan administration was not happy with when the study came out, it got a lot of attention. They were not very happy about it. She later became the ambassador to Ireland. I don't know if there was anything to do with it or not. Yeah, so that's a long answer to say, it's mainly sort of a combination of academic and government experts that are doing it.
Thank you. I think, Cam, you had your hand up and then put it down, and Marianne jumped in front of you in line. But I will honor your original hand raise.
I think Marianne could go first.
Fair enough.
My question is about the slide that you showed sort of halfway through, where you had all of the administrations listed, and then you were showing the total, and I just didn't have time to digest it, but I was really surprised that, I guess before I saw the slide, I was just assuming that since Obama was, one of his big things was the ACA, yep. That, and I'm assuming that's kind of what I'm seeing in the gray line. Is that right? That's so exactly it's not that health wasn't important. It's just Absolutely. That there were and is that, and should I just take that as his sort of, he was emphasizing this was helping the middle class?
That's right. And, and I think for Clinton Clinton less so. I mean, it's sort of interesting because Clinton's rhetoric also, so both of those presidents tried to do this thing where they really focused on health security, right? So this notion that, okay, yes, most of this is about helping poor people get insurance, but we really want to make sure that you don't lose insurance when you lose your job or when you have a pre-existing condition or something like that. And that was often sort of the emphasis in their various speeches, and and very little about race. So I think that's exactly right. Sort of this focus on selling it to the middle class, and that's especially true. I don't have it here, but in another part of the study, I'm going to compare the State of the Union addresses to the messages to Congress. The messages to Congress tend to be a little more, experty. They're longer, they're more detailed, and they have a smaller audience. And so in the State of the Union addresses, there's even more reticence on the part of the presidents to talk about, non-middle class people and people of color.
So should we think that, this is a little bit of an aside, but should we assume that Obama was partly effective at getting this through when Clinton was not, because of the messaging, because of the differences in these messaging? Do you see what I'm saying?
I do. I think it's a good thought, but no, I think Clinton's reform was never ever going to pass to begin with.
Well, okay, so you're just like, I shouldn't even go that direction because it was so. I was like, well,
he
maybe
didn't have
this is
enough
part of.
From the get-go. He didn't have enough votes, and I have no idea why he even tried.
Thanks.
Obama did.
Yeah.
Okay, Cam.
Thank you. I wonder if it would be possible to look at the president's upbringing and their own SES growing up to see if that would be correlated with these. And as a comment, there are psychologists who study a presidential personality. They've published on this. You could probably look up indices of narcissism and other characteristics across presidents to try to link to this if you're interested. My question is, is there data on approval ratings for these presidents and how they may have changed from before to after these speeches in response to these speeches?
Yes, definitely. So these are definitely some, if you're going to do a quantitative analysis of these time series, yes, you would want to look at approval ratings. You might want to look at, well, there's a variety of things you can look at. The psychological stuff is interesting. There's actually a very good book that goes through each president and looks at their health history and also the health history of their family members. And I think that could be really quite interesting. And and it matters a lot. The NIH and some congressional committees actually have lists of the illnesses of all the members of Congress and their family members so that they know who to go to when they want to lobby it for a particular disease. Yes, Charles Grassley, for example, is a big proponent of bee pollen. And so he has been a big proponent of the, there's an alternative medicine part of the NIH now, and he was a big proponent of that. But I think the psychology stuff would be interesting.
Yeah, that is interesting. Okay, Michelle, go ahead.
Thanks so much. This is such like an interesting conversation in general. I mean, in addition to your study, but also learning about the bee pollen. I was kind of curious. I don't know if this is even a thing. Was there a sense that talking about class and Medicaid at the same time, is there an advantage to maybe not mentioning class when talking about Medicaid? I'm just curious if that was something that people, or they thought or saw.
Well, it's interesting. So as you know, a lot of Medicaid expenditure goes to people who are in nursing homes who were not poor until they spent down their money to be eligible for Medicaid. And increasingly, politicians are emphasizing that Medicaid is kind of a middle-class program in that it's basically nursing home insurance for a lot of Americans. And, which could be bought there is a private market for nursing home insurance, but, nobody buys it. So it's more recent, really since Clinton, that they've been starting to do that. But Democrats have tried to sell Medicaid as a more middle-class thing, even though, obviously the vast majority of recipients are poor people and people with disabilities.
Elizabeth, do you have a question?
Yeah, I agree. This is super cool. You may have said this, and I may have missed it, but in the way that you picked these messages, are you assuming, or was there always some sort of policy proposal in them, or was it sometimes just like, messaging and identifying a need? And would that matter in terms of what they were willing to talk about, in terms of if they really had like a specific policy they were trying to push?
Good question. Yes, they always talked about policy, both in the State of the Union addresses and in the messages to Congress. In the messages to Congress, they would go into more detail about the policy that they were proposing. So yes, they would do so. I'm sorry, I forgot the second part of your question. You were wondering if that would change.
If that would matter, because I wasn't sure if some of it was like in a State of the Union, but they're really just sort of like identifying a need, signaling,
exactly.
you know.
Exactly. And that is definitely the case. So they're always proposing policies, but you know, there's a lot of there's more signaling going on. They're vaguer, et cetera, in the State of the Union addresses for sure than in the other ones.
And can I just ask a follow-up clarifying? So, yeah. And when you were talking about the number of times things were mentioned, that was within the specific message, the portion of the message you looked at. So,
correct. That's correct.
Were you curious? Did you look at all about like whether they also just tended to use race language or class language throughout the speech elsewhere outside of the health context?
It's a good question. I read the entire speech for all of them, but no, I didn't correlate the amount of race talk they were doing in the two sections. I mean, one important thing, you know, Johnson, for example, because he's like, you know, the civil rights era president, would be talking, you know, extensively about, and Kennedy too, they'd talk extensively about civil rights, and then they would say, and now let's talk about health, and they, you know, it would sort of spill over, essentially. But I didn't do anything sort of systematic about that. I noticed it, but I didn't do anything systematic about it.
I kind of wondered a similar thing. Like if we looked at the way presidents were discussing jobs or education or something, would we?
Exactly. And I think, you know, I thought a little bit about that. I could probably easily do this, you know, similar study for just, you know, the speeches in general, you know, quite apart from health. Which I think would be interesting. There have been some people who have looked at race talk in State of the Union addresses over long periods. They haven't compared it to class talk. And so I think that could be interesting, an interesting thing to do.
Drew, do you think it matters or mattered like what the major health crisis or health issue of the time was? Did that shape the way? So during the opioid crisis, were they talking about class more than race, or what did presidents say during the HIV and AIDS era? Or I mean, I guess it's impossible to tease apart those kind of like period effects from presidential.
Yeah, I mean, in the qualitative stuff, I definitely have seen some of this. So definitely HIV/AIDS led to more talk about people of color for sure. And one thing I will say is the vast majority of all of this discourse is about health insurance. So there's not that much mention of particular health problems, really. It's almost all about health insurance. But when there are particular, you know, issues in front of them, I didn't see any mentions of opioids. I did see some stuff on there's a fair amount of stuff on tobacco, but most of it's about health insurance. Yeah, it's weird that they wouldn't mention opioids in a State of the Union address.
Or, I mean, did you code Reagan's talk about drugs as a health issue, or is that separate?
This is the other. Yes, I did. I excluded drug policy from the analysis. I didn't count that as health unless it appeared in the health paragraph. So let me step back. So in a State of the Union address, if there was like a health paragraph, then I would, and drugs were in it, it was there. On the other messages, I did not include messages about the war on drugs. It's kind of, you know, and the rationale I gave is that it's a different policy area. It has health implications, but a lot of it's, you know, driven by, you know, crime and punishment.
Yeah, it could have been a health issue, but he chose.
Could have been. That's
crime
right.
And punishment issue. Do other folks have questions? We have a few minutes remaining.
I have a quick one, Drew.
Yep.
I will confess I have not read your book on abortion policy or the politics of abortion policy. Is that the right way of
Yes.
one sentence characterization?
That's
Have
right.
you done anything like this? Obviously not going back so far, but I'm curious about whether you see the same sort of discrepancy between talking about race versus talking about socioeconomic status when it comes to that kind of messaging. And of course, there the messaging from president to president is going to be even more extreme, right?
Right. So that's a really great idea, and I'm going to do that study, but not about race and class, because I don't think there's really going to be any mention at all of race and class in relation to abortion, even though it's important. But I'm actually doing a different study right now about New York Times discussions of. I'm sort of looking at New York Times coverage of the pro-life movement versus the pro-choice movement, and sort of who gets the most coverage. I think it would be interested in to do a study like this among presidents, but really just about whether they mention abortion or not. Democrats, there was a period in which Democrats did not want to say the word abortion, but that's really changed in the last couple of election cycles, I would say. But that would be pretty interesting to look at. Yeah.
Before we wrap up, I did want to get to Alex's question posted in the chat. And I think you said something about this kind of in passing, Drew, that ways that you may have looked at the sort of like implicit or coded language where class is sometimes used as a synonym for race or vice versa.
Exactly. Yeah, I mean, so for example, when Clinton talks about healthcare reform, he often, he had this whole phrase, we want to help people who work hard and play by the rules, that phrase. And so, so there were a lot of, when he talked about healthcare reform, there was a lot of stuff in there. Well, he would also say, most of these people are middle class, they're working Americans, they're middle class Americans. So he really wanted to emphasize that like non-working poor people were not, emphasized here. And I took that to be racialized, given the politics of the time. That 1996 debate was just very heavily racialized. And so even though race was not mentioned by Clinton, I think it was fair to assume that was a reference to African Americans in particular. So that's sort of how I did it. I just guessed. I looked at the context and I said, well, this also means race, essentially. Yeah, I didn't guess. I looked at the context.
You inferred.
Exactly.
Yeah, go ahead, Elizabeth.
So I just wanted to on that specific point. So then in those instances, you coded those as both race and class references?
In the qualitative data, but not in the quantitative.
Okay.
In the quantitative,
Okay.
Exactly.
Okay.
Yeah. So I just talked in the qualitative thing, I just talked about that, when I talked about their tone, basically.
Got it. Okay. Yeah.
I'm trying, I don't know if this is going to be successful, I'm trying to sort of assign a tone to each president, but it's a little difficult. And so because of Clinton's way of talking during that period, I suggested that he took a negative tone both towards people both towards racially oppressed people and towards low-income people.
It's 4 o'clock.
In that qualitative part, but not in the quantitative.
All right. Well, we're at time,
Okay.
and I think if you have remaining questions, it would be okay to email.
Absolutely.
Is that correct?
Absolutely.
Well, thank you very, very much, Drew. This was
Thanks so much for having me.
really interesting. Really enjoyed the conversation. Love to talk about it more with you.
Awesome.
Down the road.
Sounds good.
All right. Thank you, everyone. You'll receive an email when the recording is available. So you can have viewing parties at your house.
Yes. My family is very eager for that.
All right. Thanks, everybody. Have a great weekend.
That was a joke, by the way.
Mine was accidentally in it.
Oh, is that right? Well, yeah, that's good.